Okay, so an overview of what we'll be covering during this presentation, introduction. So, you'll learn a little bit more about Stephanie and myself, mission, vision, and values of the School of Public Health, and specifically, the online MPH program and the goals that the Rural Health Innovation Scholarship hopes to achieve. So we'll talk about the vision for the Rural Health program. We'll also talk about kind of the key differences between an RHI scholar versus an RHI fellow. We'll talk about the program, the online MPH program format, give you an overview of what you can expect from this online MPH program. And then we'll talk about eligibility for both the scholarship and admission into the program, the online MPH program itself. And then again, we'll have time for Q&A at the end of the presentation. All right, so once again, my name is Elise Rudolph. I'm the Director of Online Admissions and Recruitment, and I'm joined by Stephanie Nguyen, who's our Online Education Recruitment Manager. And we are your admissions team. So, Stephanie and I are really here to answer questions about the application process. We're here to make the application itself more accessible, to help you understand it, to hopefully clarify any requirements or things like that, and just generally support you as you learn about the program, consider applying, all the way through, if you end up enrolling in the program. So we are your team to really, again, help you put your best foot forward in this entire process. So definitely take advantage of advising appointments with Stephanie, attending these webinars. We really want to help you shine if you do choose to apply. All right, and the program mission, vision, and values. So here at UC Berkeley Public Health, we are about healthy people locally and globally. So our goal is to extend Berkeley's reach to improve population health, especially for the most vulnerable, and providing the tools to address the pressing public health challenges of our time. And we do this through innovative and transformative online learning with a rigorous and interactive curriculum, a flexible educational experience that aligns with the needs of working professionals, empowering public health change makers to improve health where they live in real time. So something I always like to share is that UC Berkeley, the School of Public Health, specifically offers this online MPH program as a means to achieve this vision. So the online MPH program has been around 12 years, and it really is born out of this idea that you are already rooted in your community, making a difference in your community. And so rather than uprooting folks, having them move to the Bay Area to participate in this, participate in a graduate program, we want to bring that UC Berkeley top tier education to you in the community you're already a part of, where you already are positioned to make a difference in public health outcomes. So, it's really the online MPH program is so aligned with the goals of our Rural Health Innovation Scholarship program, which we'll talk more about in a moment. But our values are service and community, showing up with authenticity, growth rooted in justice and equity, cultivating connection through learning, and centering wellness. All right, so the Rural Health Innovation Scholarship has its own unique vision that is very aligned with UC Berkeley School of Public Health's vision. So it's that the RHI program at UC Berkeley School of Public Health will produce the next generation of rural public health leaders who will both reshape healthcare policies impacting rural communities and rework and reimagine existing healthcare systems to put these policy changes into effect, enabling rural Americans to access better care and healthy lives. So we will talk more about kind of the eligibility for this scholarship in a moment. But again, the goal is really, that folks who are already living and working in rural communities, we know that there is kind of there are specific public health issues that pertain to rural communities. And it takes someone who is a part of those communities to understand those specific public health challenges and to really address them. And so this scholarship is absolutely to build up, enable, upskill public health leaders who are already in rural communities, and help them address those public health issues that specifically pertain to rural communities. And again, we're really pleased to offer this because it aligns so well with the online MPH's goal of bringing that UC Berkeley education to you where you are. All right, so just sort of an overview of what the program entails. So we, over the course of this fully funded scholarship, we hope to offer 100 fully funded scholarships for working professionals, and that'll be over the duration of the entire RHI program. Each spring, we will be offering 25 fully funded RHI scholarships. So that would be 25 scholars to join us in spring 2025. Of those 25 who are selected in the spring 2025 cohort, 10 of those 25 can further apply to become what we're calling health policy fellows. The health policy fellows will have kind of additional opportunities to work on a policy specific practicum, to spend some time in DC. And that's, in addition to all of the other RHI programming that's a part of this RHI program. And there are 2 summer visits as part of the online MPH program. So you will have the opportunity to come to UC Berkeley's campus twice. That is covered as part of this scholarship. And the program is flexible, part-time, and 27 months. So we've mentioned this before, but it is designed for working professionals. It's for folks who we know very likely have full-time jobs, might have other responsibilities like family care or things like that. So, the program is flexible, it's asynchronous, and it is designed for those who, have other responsibilities in their lives. Over the course of, again, over the course of the 12 years that UC Berkeley Online MPH has been around, we have developed a really incredible reputation as one of the best online MPH programs. So we have been named #1 online MPH program. And so, we'll talk a bit more about this, but what I like to share is we aren't here at UC Berkeley, we aren't just taking the on-campus experience and, videoing those lectures and putting them online for you to watch. We have actually a team of instructional designers who have crafted this curriculum and the learning modules to be engaging and enriching specifically for an online learning environment. So we really have tailored this program to be accessible and interesting and engaging for an online learner. And I think that's part of what makes this program #1. All right, so I want to talk a little bit more about what distinguishes a rural health innovation scholar versus a rural health innovation fellow. So generally speaking, a rural health innovation scholar are all 25 of the individuals who are awarded this scholarship in the spring of 2025. So all 25 individuals who receive the RHI scholarship will become what we're calling an RHI scholar. Now, of those, and being a scholar includes, again, all of your program fees are covered. You'll be able to participate in rural health specific programming. So in addition to the regular coursework, there will be like really interesting RHI specific content, or rural health specific content. There's opportunities to engage with the donor, Lynn Barr, and apply what you're learning in your other classes to a rural health setting. And there's also, and this is open to anyone who's doing the online MPH program, regardless of the concentration that they're in. So if you're doing health policy and management concentration, if you want to concentrate in epidemiology or public health nutrition, that's completely fine. You're still able to do, the rural health focus while concentrating in another area. One of our 4 concentration areas. Now, the fellows, the RHI fellows, are a subset of those 25. So this would be 10 individuals of the 25 who you would complete a separate application process to become a fellow. And the fellows have much more of a policy focus. I would say that's kind of the key differentiator. So this would be for folks who not just want to focus on rural health, but want to focus on rural health policy specifically. And so the policy fellows, they're still getting all of the fully funded benefits of RHI. They're still participating in all of the other RHI programming, but there would be an opportunity to attend the National Rural Health Policy Institute in Washington, D.C. So that would be part of the fellowship. And then also you would have the opportunity to work on a policy-specific practicum in collaboration with Lynn Barr, the donor. So those are sort of the key differences between our scholars and our fellows. And with that, I'll hand things over to Stephanie to talk a little bit more about our program.
Thank you, Elise. So Elise has already shared a little bit about the program format, but to add to that, the units that you'd be taking in our program is typically 6 units, and that's about 2 classes over a period of 7 semesters. So there is a total of 42 units that must be completed in order to graduate. There's the time of completion, which is 27 months, but I'll also, in another slide, walk you through some of the options around your completion time, but this is just the average to expect. The concentrations that we offer within our program are health policy and management, public health nutrition, interdisciplinary, or epidemiology and biostatistics. If you're unsure of where you see yourself, you can always schedule an appointment with me and we can go over the concentrations a little bit more specifically if you're in between choosing your preference. And the type of degree that we do offer within our program is a professional MPH. So the professional MPH is geared towards specific training that is CEF accredited, and that is the Council of Education for Public Health. So we really adhere to those specific standards to make sure that you're getting high quality training that can support the needs of public health. In addition to that, we also have a format of 90% online and 10% in person. So there are 2 summer visits that are required within our program, meaning that most of your work would be completed asynchronously. You don't have to log on at a specific time, despite there being deadlines within the program, so keep that in mind, but there is flexibility with completing that. Now, there are the 2 summer visits where you would attend UC Berkeley School of Public Health, be here in person, meet your peers, have connections with your faculty members, advising. I consider it to be an academic conference. It's a full day of learning, but a lot of opportunity for you to enhance your engagement with the Berkeley public health community. In addition to that, the campus visits are split between your first and second year of the program. So they are generally held between 5 to 10 days. We also provide this information during your new student orientation, during your onboarding. So you'll have plenty of time to prepare ahead for accommodations, if admitted into the program. The course delivery within our program, as I mentioned, is asynchronous. So you don't necessarily have to be online at a specific time, but there are going to be opportunities for you to build in synchronous sessions. Sometimes we have kickoff sessions that just are there to help build community within the program. Sometimes we offer live guest lectures to come join us if there's a hot topic involved. And those don't necessarily mean that that you have to be there, but they're encouraged. So it won't impact your grade. Just another way for you to for us to be accessible to you and engaged. The weekly commitment within our program is that you'll spend 15 to 17 hours per week on your course assignments as well. And this includes reading, responding to the discussions that you'll have for the week, and your personal assignments as well. So all in all, about 15 to 17 hours on average. And moving over to the timelines for program completion, as I mentioned, it is a 7-semester program meant to be completed in 27 months. So on this top row here, this is what you'll see and expect for a traditional student in the online program. You'd be taking 2 classes over a period of 7 semesters. The reason why you see these courses boxed on top of each other is that you'll take these courses together at the same time for 15 weeks of instruction. We do this to kind of help you ease into the program. We understand that you may be coming into the program after being outside and away from, you know, school for many years. So this kind of helps us build a longer form of instruction at a slower pace to kind of help you ease into the curriculum. And this is taught for about 15 to, I would say about 15 weeks of instruction. Moving on into summer, because summer is a shorter semester, this will move into 6 to 8 weeks of instruction back to back. So we will teach the courses consecutively, not concurrently. Within the fall course, we will repeat the 15-week instruction to kind of slow it down again. And once you get into your second year, you'll have a better understanding of what you're interested in, what you want to concentrate in, and this is where we start to pick up speed a little bit. So all the courses from this point on will be taught at 6 to 8 weeks of instruction. So as you can see in this year here, they're going to be focusing on core and breath classes. And we will tell you what classes to register for because they are core and breath classes. So you don't have to worry about which classes you need to figure out selecting. We will help you with that. Moving forward, let's say that you find yourself at a point where maybe you want to accelerate your course completion. You can do that within our program. You can accelerate it to enhancing 3 units to your workload. So that would be a total of 3 classes, 9 units total. And if you need to take a break, maybe you have a change within your personal life, professional life, and you just need to take a break, you can also do that. So we are here to be flexible and supportive of your needs. But I do find that most students just stay with the traditional route, as that works quite well within a busy, schedule that you might already have. I like to think that we just add to your calendar, but we don't necessarily make it any more difficult, as it's pretty structured throughout the program. But with that said, I'd like to move into the practicum requirement. So there is a practicum required in our program. We don't have a capstone, but we focus more on applied projects to ensure that you are engaging in your public health courses and bringing it into your professional experiences or bringing it into relevant public health needs. And the practicum in itself is a structured pathway where students can obtain practical experience within the field of public health. And this is meant for you to utilize your training in real time. As we know, public health does not wait for anyone. It is a 24/7 field. So we want to be able to ensure that we are giving you real-time support and helping you expand those skill sets while in the program. It is a self-directed program, so structured guidance is the operating model within our program. It's a minimum of 130 hours, but you can stay on for a little bit longer if that's something of interest. The average time of completion for the practicum is typically between 3 to 4 months. The practicums may also start anytime between your second semester or as early as your second semester, but you must complete it within the sixth semester. Fellows are required to complete a policy-specific practicum. So on my left, this is what you can expect to see. We have students moving into nonprofit practicums, healthcare system planning, academic research, private government. So there's different variations on what a practicum can look like. It can be hybrid, it can be remote, it can be in person. And it's really up to you to decide. So if you're unsure about what that looks like for you, we actually do have a team called RISE. They are our career and professional development team that focuses on practicum support and also looking at the long term, helping you, maximize your goals and skill sets through the practicum and looking at the long term for career support. So they will work with you to guide you throughout this whole process there. And for the rural health innovation eligibility, if you haven't browsed our website yet, some few things to be aware of are that RH scholars should work or reside in a rural community as defined by HRSA. In a moment, I will click this link to kind of walk you through what that will look like. You must also have a deep understanding of and a passion for improving public health issues, particularly to rural communities. This is really important, kind of the essence of why this scholarship exists, and must have at least 3 to 5 years of post-baccalaureate work experience, with a preference for 5 to 7 years of work experience. Management experience is not required for this specifically. And rural policy fellowships, make sure you have an interest in policy and advocacy. And fellows are going to be selected in the summer of 2025. There is a homepage here, so keep in mind that I will be sending out these slides and any underlined information here will be clickable for you to explore as well. But let's see if we can take a look at what this looks like. So let's just say that I want to use my address here in Berkeley. I just plug it in. Going to tell you what your information is. So, Berkeley is not defined by HRSA as a rural community, but if I'm fortunate enough to live in a location where maybe it is, let's pull it up here. It will just be very direct and transparent and say yes. So that's something to expect if you are in a rural community. And moving forward with the eligibility and the application checklist, I'm going to actually pass this back to Elise to discuss a little bit further about the next steps of applying.
Thank you. Yes. So, as we've expressed, the RHI scholarship is a scholarship that's available to folks who are accepted generally to the online MPH program. So there's 2 phases to become an RHI scholar. You must first apply and be admitted to UC Berkeley's online MPH program, and then you'll fill out a supplementary application to apply for the RHI scholarship. So we want to talk a little bit about how to apply to the online MPH. So Stephanie already kind of talked about the eligibility for RHI, but we do also have some prerequisites and eligibility requirements for the online MPH. So just to reiterate, those RHI scholarships, we're ideally looking for folks who are already living and working in rural communities. Again, a huge part of our goals and our values in this initiative is to what we describe as education in place. We want to upskill folks who are already making an impact in their rural communities. So definitely use that HRSA tool that Stephanie shared to verify if your working address or your home address would verify or would qualify you for RHI. The supplemental RHI scholarship will also ask you a few questions about your work experience with rural communities, your goals for entering the program. And we are looking for you to have some prior work experience, ideally at least 3 to 5 years work experience. And I'll reiterate that, even if you opt not to apply for RHI, our program is definitely ideally designed for working professionals. So we do like to see that you have usually at least 2 years of work experience, even if you aren't applying for the RHI scholarship. And then we really want to emphasize that we recommend statistics or college level math with a B+ or higher prior to applying to our program. So there's a few ways that you can meet this quantitative requirement. Again, stats or math with a B+ or higher, or if you work in a setting where you're using quantitative skills routinely, we would definitely be willing to consider that. But essentially the thought here is that, your first year required coursework has a pretty quantitative focus. And so we just want to ensure that you're going to be successful in that first year of required coursework. And then we're looking ideally for a minimum of a 3.0 GPA. So to get into the required materials, there are 2 essays, a statement of purpose. The statement of purpose is, you sharing with us why an MPH degree, why is a master's in public health the right degree for you and your future goals? Why now? Why is this the moment in your life when an MPH makes the most sense? It's, what are your goals? What are you hoping to achieve? And why UC Berkeley? So that's really what your statement of purpose is about. And then the second essay is your personal history statement. And this is for you to tell us who you are. So this is an essay that's describing your personal lived experiences, all those things that really led you to be interested in public health, all the things that, have contributed to your, the qualities that you have that would make you an excellent public health practitioner. So, this is an opportunity for you to really tell your own story to the admissions committee. So 2 distinct essays, 2 different purposes. We're also looking for 3 letters of recommendation. Ideally, these would be from academic or professional sources. We understand that many folks have been out of school for many years, and so you are welcome to use only professional sources if that's more accessible for you. We do need to see all of your prior transcripts. So these can be unofficial, but do ensure that you send us transcripts from all of your college level coursework. So if you transferred, if you did some community college coursework, if you took a summer course, but it transferred in, please do send us all of those unofficial transcripts. Now, the next item on this list, your advanced GPA, tends to be one of the more confusing requirements. But essentially what we're looking for here is your GPA after your first 2 years of undergraduate study. So, essentially all of the undergraduate classes you took after your first 2 years. This is the GPA that we primarily look at to evaluate your academic preparation. And the reason we use your advanced GPA is really because we understand those first 2 years of college are a huge transition period. So this is something that's meant to be favorable to you as the applicant, because we know that for most individuals, they tend to settle into their study habits. You're taking the classes you're more interested in, your major classes, and so your advanced GPA tends to be higher than your overall GPA. So do use the advanced GPA calculator that's linked in this presentation to determine what your advanced GPA calculation is. Stephanie and I also offer advanced GPA calculation workshops, so keep your eyes peeled for that if you do end up applying. The next few are fairly straightforward. We would love to see your resume or CV, some documentation of work experience. So this can be as simple as a note from your HR office saying this person works at this company. There is an application fee of $135. We do not require the GRE, but if you happen to have taken the GRE, you are welcome to send us those scores. And then if necessary, we may require an English proficiency exam. This would be if you did your undergraduate coursework outside of the US. And those are the application requirements. Again, you'll apply to the program, the online MPH program, and then there will be the supplemental RHI application.
And now we're getting closer to the end, and I'm sure you're curious of when the admissions process begins and closes. So our applications are open right now for the spring of 2025 application term. So you can start your application today if you have not yet. We actually use UC Berkeley's graduate application portal. So it's only one application. Be sure to choose Public Health Online program if you are starting your application for the first time. The deadline will close on April 8th, 2024 at 8:59 Pacific Standard Time. The admissions decisions will release late September to mid-October. And assuming that you do apply for the RHI scholarship or just in general for any other scholarships that may be available at that time, such as the Dean's Health Equity and Leadership Award, the decision releases on October 16th and onward. So there are going to be two separate decision letters. You'll hear back first of your admission letter, and if admitted to the program, you'll hear back with a secondary update. And then the program will begin in January of 2025. And with that said, our next event is the UC Berkeley Online MPH Information Session, Health Policy and Management with Dr. Brent Fulton. So Dr. Brent Fulton is a longtime faculty member within our online program, also teaches the on-campus program as well, specifically in health economics. If you're interested in that, it'll be held on Thursday, April 11th at 5 p.m. Pacific time. All events are always recorded. Slides are also sent out, but we would love for you to be joining us virtually live so you can ask questions directly and get to learn a little bit more about the specific curriculum in itself as we'll walk through that.